Los Angeles County neighborhoods with higher traffic pollution have higher death rates from COVID-19, according to a new UCLA Fielding School of Public Health study, which also further highlights how the pandemic has exposed social disparities in wealth and race. The study, to be published in the August edition of the peer-reviewed journal Environment International, found that Los Angeles County neighborhoods, from Long Beach and Bellflower to South and East LA to Pacoima, with the highest levels of pollution saw a 60% spike in COVID-19 deaths, in contrast with communities with the purest air. All of these areas tend to have larger populations of Latinx and Black residents, said Dr. Michael Jerrett, Fielding School of Public Health Professor of Environmental Health Sciences and the project's leader. He added that the findings are especially important for prioritizing COVID-19 prevention measures in polluted areas. What also concerned Jerrett and the research team, which consisted of UCLA's Fielding School, UC Berkeley, and UC Merced, was that because Black and Latino residents have higher rates of pre-existing conditions, air pollution in the form of nitrogen dioxide may be elevating the risk of infection and ultimately death in local neighborhoods. Many of those neighborhoods are particularly vulnerable, situated within 300 yards of pollution sources, such as longer-term exposure to emissions from cars and trains, as well as particles from tailpipes, tire tread and road friction, adversely affect humans. They associated with a range of respiratory ailments, including asthma and respiratory tract infections. Jerrett noted that nitrogen dioxide impairs the function of macrophages and epithelial cells, which can damage the lungs. Jerrett also noted a troubling connection of long-term exposure to unclean air to diabetes, hypertension and heightened weight levels. In effect, researchers suggest that such impairment, fueled by dirty air, leads to higher rates of pre-existing conditions in poorer communities compared to the cleaner atmosphere of some more affluent regions of the county. The conclusion? The elevated risk of case incidence and mortality observed in these populations might result partly from higher exposure to air pollution. As COVID-19 data reporting improves and data access is given more readily to researchers, we will further refine these analyses to the individual level in a spatial framework. Jerrett stressed that air pollution is not the only factor involved in increased COVID-19 rates in the hardest hit of communities. Such communities often are populated with residents who work in frontline business sectors, where they are also vulnerable to COVID-19. The communities may include multiple people living in one household, and such neighborhoods may have less access to green space.